So daily we get bombarded with bad news, and it seems to just create more anxiety amongst us. Regularly, in response to this, I try to find a positive spin, and that's really what I want to focus on. What I don't hear a lot of is many of the metabolic factors that we can change that are relative to this whole concept of viral infection. So when we're looking at COVID specifically, there are things that we know that put people at a higher risk that we can change. I'd like to put some videos together specific to each of those different nutritional pathways that an individual could be implementing so that you have some more ammo in your back pocket to support yourself and know that daily you're doing things in a positive fashion to make you a stronger individual so that you know that you've done what you can do to protect yourself and hopefully sleep better for it. And wake up the next day, again, healthy, knowing that, you know what, I'm going to be exposed to stuff every single day of my life, and I'm healthy right now, and my body should be able to deal with this well. The things that I'm going to focus on over the next couple of videos: vitamin A, C, D, zinc, and glutathione. Today I just want to take a second and talk about vitamin D, because that has, I don't know if it's the most research, but a significant amount of research in terms of upper respiratory infections, viral infections, including the virus that we're all working with right now. So when you look at vitamin D, on a blood scale, when you're testing for it, it's going to be ranging from a low of 30 to a high of 100. That's the range. That's the clinical reference range. I've been testing vitamin D in the county that we live in for over 25 years, and I find on average, patients come in testing at 32 on that scale of 30 to 100. Now, they're within the clinical reference range, so does that mean that they're okay? Not really. Not unless living on minimum wage is the manner in which they want their body to function. So it does prevent a few overt disorders, but it certainly does not optimize their immune function or several other factors related to vitamin D. For example, if you can get your vitamin D above 60, it cuts your risk and incidence of all cancers by 50%. It's a really cost-effective way to provide your body with some cancer protection. Another statistic related to vitamin D is that if you get into that same range, it has a clinical benefit relative to depression. And when you're below 30, almost invariably, and I've seen this repeatedly over my last 25 years, when somebody gets their vitamin D, let's say they come in and they're at 9 or 10, which is really low, and I've seen that many times, sadly. When they get it above 30, they're thinking differently. They're feeling different mentally because their body finally has enough of this pro-hormone, which vitamin D is, to facilitate a variety of pathways that previously were compromised. Another interesting factoid on vitamin D, when you're below 30 and you get it above, it tends to make your joints and musculotendinous junctions happier, so you ache less. And another factoid about vitamin D is when you get it above 60, it helps to prevent cytokine storms and upper respiratory infections, so it keeps your airways open. Now, it by itself isn't the be-all nutrient, but it's a very important one, and that's why I listed it amongst 5. Today I'm just trying to break down that one individually, but I want you to understand that it works in concert with these other micronutrients. When they looked at individuals who had passed with the flu back in the early 1900s, what they found, because they still actually have some of these corpses on ice, what they found is that their tissues actually universally were depleted in vitamin D. And some of the hypothesis there was that, wow, vitamin D may have been a player for why these people developed pneumonia. And subsequent to that, there's been a number of studies that have looked at vitamin D and upper respiratory infection and have confirmed that hypothesis, that it is a key player and regulator to inhibit cytokine activity in the upper respiratory tract. So I've become a strong proponent for people to know their vitamin D levels, make sure that they're targeting between 60 and 90 on their blood levels, know what it takes for them to dose to get to that point safely, and once they do that, maintain it at that level. Realize that just because you got it to that level doesn't mean you should stop supplementing, because unless you're living at the equator, most people are going to find that their vitamin D levels are going to plummet again over the course of a few weeks to a couple of months after they stop supplementing. So it's something that you need to stay on top of and be aware of. So that's my little snippet on vitamin D for the day. I hope that helps you, and I hope that you're able to take some action on that, and look forward to some of the other videos related to those other micronutrients that I just mentioned. Have a great day.